Well, good morning, folks. We're at the top of the hour here, and so welcome to our Alaska Collaborative on Health and the Environment webinar. This month's series is entitled "Protecting Children's Environmental Health While Reopening Schools: Recommendations from the Healthy Schools Network." And my name's Nick Reardon, and on behalf of Alaska Community Action on Toxics, I'll be hosting today's webinar. And we're joined today by Claire Barnett with the Healthy Schools Network. And we'll be discussing guidelines and protocols for opening schools during this pandemic in a healthy way, as well as updating certain maintenance and other issues related to our nation's schools. For those of you not familiar, CHE Alaska is a regional partnership group of the National Collaborative on Health and Environment. And our aim is to advance knowledge and effective action to address growing concerns about links between human health and a range of environmental factors. So more information on that is available at our websites, either akaction.org or healthandenvironment.org. As usual, our session will last about an hour, and we've reserved time in the second half for discussion and Q&A with listeners. And for those of you joining us on Zoom, you can type your questions at any point into the chat box, and we'll pose them to our guest in the second half of the call. And for folks calling in by phone, we'll take a minute here and there to check in and unmute lines and see if anyone wants to chime in. Try to juggle those two different technologies. A bit more about our speaker. Claire Barnett is the founder and executive director of the Healthy Schools Network, as well as the coordinator of the Coalition for Healthier Schools. She's been honored with quite a few awards, including from the US EPA, but for most recently, for national awards, the William K. Riley Award for Environmental Leadership and the American Public Health Association's David P. Rahl Award for contributions to public health through science-based advocacy. The network itself, Healthy Schools Network, it challenges the nation with a call to action to ensure that schools are environmentally responsible to all children, to personnel, and to communities. And so as a child health advocate, Barnett convened the fledgling network in 1995 as a New York statewide coalition, and it's since shaped and won new funds and multiple laws on school environments in the nation's third largest educational system in New York State and the nation's single largest school district in New York City, as well as on the federal level, and fostering state and regional reform coalitions. So I think we're in good hands here. So yeah, welcome again, and Claire, and thanks so much for joining us today.
Thank you so much, Nick, and many thanks to ACAT for the great work that you're doing and for the invitation. I've presented in Alaska before, thanks to your leader, and we'll keep looking forward to doing that again. Healthy Schools Network is a 501c3 not-for-profit. We're centered on children's environmental health, and we were founded in 1995. And I will just keep running here. I want to talk to you about how we frame the issues, and you may find this helpful as well in Alaska. We know that children are not just little adults. They're uniquely vulnerable to environmental hazards. They're still developing. They have very specific behaviors that may put them at greater risk. They absolutely cannot recognize threats or even talk to you or articulate their exposures. And there has not been a lot of timely research on this awful virus and on children and the impacts. By the same token, just while we say children are not just little adults, it's really important to understand that schools are not just little offices. They're not built the same way, they don't operate the same way, they're very different. In fact, schools across the country, K-12 schools, are more densely occupied than either offices or nursing homes. And about 95% of all the occupants in public schools are women and children. And those are two very vulnerable subsets of the general population. Not only that, but schools have a mix of processes under one roof. By that I mean, you might have a chemistry lab in one room, you might have a kindergarten on the other end of the hall. There are a mix of things happening in the building that you typically would not find in an office or in a nursing home. It's more of an industrial setting in some ways. There has been a lot of federal research and quite a few pieces of reports coming out on the condition of America's schools beginning back in 1995. That generally the facilities are in poor shape. They've got poor air quality, poor sanitation, growing molds, a history of legacy toxics built into the infrastructure. And certainly there's been no consistent funding at a federal state level and very, very little oversight. There's a history of schools being very, very local. And I'm sure all of you see that in local news when there's budgeting, education reforms are on the table. We're local, we just need the money. So we'll talk a little about what actually happens here. Our research and others have shown that all states require children to attend school. That's not a federal issue, that's a state issue. Schools and childcare facilities, as both of them, have environmental health problems that impact children's health, thinking, and learning. Whoops, sorry. At the same time, while we have all 95% of the occupants are women and children, we've learned that schools are actually not required anywhere in any state to have an infection control plan or to stay current on ventilation standards. This, of course, is a big challenge when there's an airborne virus that's causing a pandemic. OSHA regulations cover all private schools. In other words, there's some occupational safety and health regs in the private sector. But to cover public employees and public schools, states have to adopt a state OSHA plan, and that's happened in 24 states. However, no state provides any kind of environmental public health services for children at risk or with suspected exposures in these settings. So in other words, you have employees, school personnel, who do have some coverage, imperfect though it is, they'll have some coverage and some rights. But children who outnumber adults typically in a public school by 8 or 9 to 1 have none of these services available or rights. Beyond that, the poorest communities always tend to have the schools in the worst physical condition, and this is because very often local schools are funded with local property taxes. So if you're in a poor community, it's a little harder to raise that tax base. However, not all school environmental improvements are costly. In fact, some of them will help with attendance and health and learning. I want to talk a little bit just to the picture on the right. I know people have heard a lot about carbon dioxide, and it's in the indoor environment, it is an indicator of poor ventilation, increased air pollution.
Claire,
that's because
if I can interrupt briefly, I should have said this earlier. I apologize. This is entirely my fault, but to share your screen.
I am sharing my screen. No?
Oh, is it just on my end?
I don't see it either.
Let's see.
You speak so clearly. I was right there.
Well, let's.
I've shared the link to the presentation slides in the chat for everyone, so I think some folks.
Well, let's.
That way. I know. My apologies.
Let's. Dear, from the. Okay, now I have to get you. Let me get share screen. Now do you have it?
It's perfect. There it is.
All right. So we've done. Children are not just little adults, but it's a great message. I'll say it again. And schools are not just little offices. I'm sorry about that.
My apologies. I think I should have done that earlier. But go right ahead. This is great.
Well, I don't seem to be. There it goes. And we talked. Here's high CO2. Now, what's interesting here is this picture on the right, and I believe this comes from activists in the state of Washington. That's a CO2 meter. Now, CO2 is what we exhale, and it's an indicator of poor ventilation. In other words, no fresh air coming in. What the science is showing is that adult critical thinking skills begin a steep decline at 1,000 parts per million. And this particular classroom, which looks like high school kids, shows over 4,000 parts per million. Research in US classrooms has shown typically CO2 levels measure over 2,000. So if you're a parent and you're worried about your child doing better at home on home-based learning and not doing as well when they're in school, one of the things you might think about is CO2 levels and the amount of ventilation in the classroom. So as I mentioned in the previous slide, some things are expensive to fix and some things are not so expensive to fix. Schools everywhere have legacy conditions. So here's an example on the left of the screen of a leaky roof, which has opened up lead and PCBs and asbestos growing molds and so forth. Asbestos is expensive to remediate, to completely eliminate. On the right is a problem with what's called fence line school, adjacent to a chemical plant. This has to do with the siting of schools, and with this, we actually don't know if the school was there first and the chemical plant moved in after the fact, or vice versa. The school was there after the plant was already in place. But one of the things to know about school siting is that it is, in fact, if someone's going to go out and build an all-new school building, the most expensive bad decision anybody can make. So you do have to get that right. Because if it is a bad decision, it's compromised land or it's in a bad site for some reason or another, it's very difficult to get that right and really account for all the changes. This is a medium cost problem, a series of medium cost problems. So there's a fan down in the lower left. This is from a City of Philadelphia public school. The walls were wet from roof leaks and the lead paint is flaking off. But what the fan is doing is, while they're trying to dry out the wall, which is a good idea, it's actually blowing lead dust in the classroom. Broken toilet, that's something that can get fixed. It's not a major expenditure. Dirty custodial closet. If you have a dirty custodial closet and it looks like this, you know you will not have a clean school building. If you are a parent or a school board member or a member of the community who has been invited to do a tour, who has requested one, if you ask them to unlock the custodial closet and it looks like this, you know you have problems automatically. On the lower right is a new slide we just acquired from the New York State Department of Environmental Conservation, which has been running a voluntary program called a school chemical cleanout. And what has happened over the years in many, many states and many local school districts is the biology or chemistry teacher retires, somebody else comes in, and they really don't want to touch the things that are misstored or mislabeled in the old closet. And so there's a gradual accumulation of nasty chemicals in schools. These are can be very expensive to deal with, particularly in New York State, because you have to identify the chemicals that you're disposing of and make sure they're disposed of properly. And if they haven't been properly labeled or stored, that compounds the challenges. Now here's one that is actually costs nothing to clean up, and this is what we call a hoarder classroom. And it's all too typical of a lot of classrooms. So there are a variety of indoor environmental challenges here. One is it's filled with dust catchers. So if you have a child with asthma, this is going to be a very dusty classroom to be in. It's very difficult to determine what to clean or how to clean it, or where and how to apply disinfectants. Furthermore, pests are always drawn to any food and plants in the classroom. And in fact, the larger version of this slide, there's some coffee cups over on the inside of the photo. Airflow is clearly impeded. It would be very difficult to have a lot of good fresh air cleansing the room on a regular basis. On top of that, all the decorations hanging from the ceiling are all flammable. This is a fire hazard. The cost to clean this up is really zero. It's just removing things and cleaning out the room. The cost to set it up was actually somebody, I'm sure, a classroom teacher has built up this accumulation of favorite projects over a long time to kind of personalize his or her room. But in fact, the room is a public health hazard. Let's talk a little bit about the pandemic. Now that you understand what buildings were like before the pandemic started last spring, let's talk about what's happening, what has been happening in the last 7, 8, 9 months. So there's clearly a disproportional burden of the ongoing pandemic. In fact, the Black, Latinx, and Native American communities have been hit hardest by COVID, are sending their children back to the poorest schools in the worst condition. We also know that across the states, there are no uniform programs about how states are handling what happens in local schools. And this is a fragmented piecemeal approach, which we believe will speed the spread of the virus. It sows confusion. If you've ever sat down and had a sandwich with somebody, start talking about, well, how are your children going to school? Are they in person or are they distance, or how many days in, how many days out? Do you know what they're doing for cleaning and ventilation? There's a lot of confusion, certainly among parents. This also deepens disparities because wealthier schools and wealthier communities can afford to take on and address some of their ventilation and cleaning problems. But the lack of consistency and lack of standards also stymies research on how to keep schools open and keep kids healthy. We did a big report, which we're going to talk about now. And I think, Alex, if you're on, if you'd put a link to the report in the chat box for folks, that would be really helpful. Thank you. We partnered primarily with New Jersey Work Environment Council. They were fabulous partners. It's a statewide coalition for occupational safety and health in New Jersey, and pulled in the American Public Health Association, the New Jersey Education Association, the New Jersey PTA, National Association of School Nurses, Asthma and Allergy, and many, many more. In the end, by the time this was released in the beginning of July, it was co-released by 20 different organizations and had been reviewed and endorsed by 60 different organizations. We're trying hard to create some consistency here, but it's hard to tell. So really what the report says is that it is a public health imperative to keep children safe at school, no matter if you're in a pandemic or not. It's a public health imperative. We believe the state's role should be providing infection prevention and control plans for local schools. In other words, if you have a state health department, that's where somebody has to come in and say, we need to have a model, a very authoritative, but a model school infection prevention and control plan that covers not only how you're going to take care of the occupants, but how you're going to take care of the building in a great deal of specificity. We think states should have hotlines and a system to follow up on complaints, and also to require schools to report attendance and new infections. Some states are doing that today and some are not, believe it or not. We also think that if a state produces a model plan, that local schools should convene their local stakeholders to adapt it to their particular buildings and their particular community, and then adopt it as a policy statement. All schools are required to have all hazard emergency management plans. So those are, earthquakes and tsunamis and active shooters and all the rest of those things. And this could very well fit into it. The other thing that's really important about this, because most people have focused on attendance and how many people are in the building as a measure of whether you're doing mask or distancing or distance learning. But the condition of the building itself, the condition of school facilities, will actually affect the transmission of the virus. You just saw that with the CO2 slide. There's no fresh air. The virus will build up in the indoor environment. There are also issues with school staff vulnerability to COVID-19, the disease itself, in schools. School staff, the teachers in schools tend to be older, particularly in NEA and AFT. They're older. There's an age vulnerability with the SARS-CoV-2 virus that causes COVID-19. Children certainly are susceptible to it. Children do get COVID-19. They don't seem to have symptoms that are as severe, although now that more children are back in school, more children are showing up positive. Whether they have symptoms or not, children can shed the virus and infect other people. And that's one of the challenges of schools when they're more densely occupied than nursing homes. So let's talk about what we think the internal of this should be. And again, we think that state public health agents should be doing this work, but there's no reason why a community itself could not do the same thing. A school infection prevention and control plan should specify how the building will be opened and kept open and maintained to reduce the presence of the virus, and how occupancy rates and occupancy will be managed for optimal health and learning. What do we mean by reduce the presence of the virus? We know that there's no such thing as a mold-free building, doesn't exist. There's no such thing as a bacteria-free building, it doesn't exist. There's not going to be any such thing as a virus-free building. In fact, the coronavirus has been around for a long time, passing around the common cold. So the real challenge is, how do you keep the lowest possible levels that would prevent the virus from really overwhelming the school population? So there are two parts to this. On the left part of the slide, it's one thing to reopen a building. So for many people, particularly here in the Northeast, our schools were closed in about the second week of March. And so they were not really, in fact, opened up or had very many people inside until the end of August, beginning of September. Some of them still are not open. So reopening a facility requires going back after those routine inspections that all buildings are required to do. You need to assess the outside and the inside of the spaces, start creating a list of prioritized cleanups and repairs, check the building systems, check the air, check HVAC, heating, ventilating, and air conditioning system, the plumbing, the electrical, communications, get the school ready to be occupied. Drinking water turns out to be a tough issue because drinking water systems in large buildings that have been closed for weeks, if not months, can build up contaminants. Specifically, they will accumulate lead in the system, and it takes weeks, hours or weeks to actually flush it out of the system if it's been sitting there for a long time. By same measure, they will also accumulate bacterial contaminants like Legionella. So all schools have been told, as far as we know, by their state health departments when they're reopening, to consult with their local public health agencies about how to reopen their water systems and their air conditioning systems. And because you're going to have people coming in and out of the building on different shifts and different age groups, it would be a good idea to update and review those emergency management plans, even life safety exits. How are you doing on that? And of course, inventory and stock supplies. So keeping the building open is a little bit different. As we say, anybody can open a building once, but the trick here is, how do you keep it open for the longest period of time for the most people, most of the people? And that really gets to a hierarchy of controls in occupational safety and health. Engineering controls on the building will help it stay open longer. That's better ventilation and filtration of outside air coming in and filtration of air leaving, cleaning and disinfecting with a regular protocol, safer pest control, which I know ACAT has spent a lot of time on. It's also tracking and responding to building complaints and illnesses. Just because you've done everything right the first time and you've gotten your building ready to open, buildings don't take care of themselves. If there's a leak, if there's a break in something, if something happens, you absolutely have to stay right on top of complaints and illnesses. And going back pre-pandemic to original work by EPA and other organizations, in indoor environments and indoor air particularly, the rule of thumb is always take the first complaint seriously and investigate it thoroughly. You don't want to miss it. Don't let it build up. And of course, closures. We now have examples here in the Northeast, you may have them in Alaska as well, where school buildings have opened part-time for a period of time, and they suddenly have a small outcrop of 4, 5, 6 infections in one particular building. And so they're going to close the building for a week or two, just to let everything settle down. But the closure itself is a benefit to anybody working on facilities. It's extremely difficult to work on school facilities when they're fully loaded with occupants. So your school should think about using that list. Look at the left-hand slide here, the save your list. Go back to the list and use the closure as an opportunity to address priority repairs, fix the broken toilet, clean up the messy classroom, and so forth. As there are a lot of asthma triggers in schools, and as you know, people with asthma are one of the higher risk categories for COVID-19. So we'll talk a little bit about asthma triggers here. They exist everywhere, whether in homes or schools or communities. We're going to look here specifically at schools. So one of the things is cleaning, sanitizing, and disinfecting may infect people with asthma and may not. First of all, you want to clean with soap and water, which will decrease the presence of the virus. Sanitizing is defined as lowering the number of germs on a surface to a safe level. But products that are labeled sanitizers are not registered to kill viruses. So don't confuse the two. The process of disinfecting is that it will deactivate viruses on the surfaces. But a virus will come back every time a dirty hand or a sneeze droplet falls on the surface. It's no longer a disinfected surface. Not all disinfectants will kill the coronavirus. Some do and some don't. Some disinfectants are meant for HIV. Some disinfectants are meant for other kinds of viruses. So you'll have to look on the label and it will say what the target organism is. So you need to read and follow all directions exactly. In choosing any one of these cleaning, sanitizing, or disinfecting products, it's really important to avoid chemicals called asthmagens and chemical irritants. And schools can do this and states can help them by buying safer, low odor products. And there's a warning here, specifically a caution on the use of foggers and misters of disinfecting products. And I'm sure many of you have seen the same news clips that we've seen of somebody in a Tyvek suit walking down a line of lockers in a hallway and spraying the place. It doesn't necessarily work. It's a great photo op for the disinfectant industry, but it doesn't necessarily work. So be careful not to overuse disinfectants and never allow children to apply disinfectants or disinfecting wipes, because disinfectants are in fact antimicrobial pesticides, and you don't want children involved in pesticides. So if your school is actually thinking about using more product, applying more antimicrobial pesticides, check in with the public health agencies. The vendors themselves may be pressuring schools to buy new or emerging products, and schools could in fact save money by checking the EPA N list, which is the list that EPA has created. It's an Excel spreadsheet to see if the product is registered against the human coronavirus. We have some tips here on green cleaning, and I think I've presented these before for either Che Alaska or for ACAT. But we have a specific website that was set up more than 10 years ago by a collaboration of people, including the teachers' unions, to work on green cleaning. There's startup tips, what parents can do to get things moving along, and classroom staff, what they can do, as well as what custodial staff can do. It's really important to think about green cleaning because these are independently third-party certified, greener and healthier. Are they the most perfect products in the world? No, they're not perfect. But what they do is the certification process sets a bar and said, all the products that meet this certification by either Green Seal or Ecologo have at least met this level. And beyond that, you could look for, we want all the products that at least meet this level, and we want them to be unscented or fragrance-free. I mean, you can add a layer of protection beyond that if you're interested. Right now, I think it's 11 states either have policies or actively, 12 states have policies or actively promote the use of third-party certified green cleaning products in schools. That said, I'm sure larger cities in Alaska would be able to do this. I think remote villages would have a very difficult time just because of the access. So I wouldn't recommend it for everybody, but it's worthwhile asking about and having the state help out. Staying open also involves regular cleaning and disinfecting. There is great guidance that has been published by New York State as well as by Washington State. And I think I can give you an example of the New York State Joint Memo on Cleaning and Disinfecting in the next slide. On the right, the colorful chart here is from an organization, nonprofit called Green Seal, which is now about 30 some odd years old. And it is an international green certification eco-labeling organization. It's based in Washington, DC, highly reliable. This is their chart that they allowed us to include in our pandemic report that talks about where to look for these products. Should you use something that's already on the EPA list? Yes. Should you use these electrostatic sprayers or ultraviolet ozone or steam? They say you need a lot more information. You have to be very careful about that. Should you use foggers? Absolutely not. Blue light? Absolutely not. There's no data. And I'd be happy to take questions on the fogging because we did some work on that. So I'm going to click here and show you, I think I can click on this and show you exactly what this New York State joint memo from the education and health departments are in cleaning and disinfecting. And you can locate it too from this. There we go. So this is a rather large production done by the two state agencies, and it runs on for a number of pages. But they began at the end of 2019 when they saw the new respiratory disease coming out. Now how do I get back to my, how do I get back? Great idea. Am I back yet?
I can still see your, yeah, I can still
see me. Now I've got to get back to my, here we are.
Cool.
There we go.
It's working.
Yep. Great, thanks. So there is the New York State Education and Health Department memo. And it also gives you a list of frequently touched surfaces, hard surfaces, which it's suggested that you apply cleaning and disinfectants to. There are a lot of them, whether it's classroom desks, door handles, push plates, kitchen, bathroom faucets. I suspect that your health department in Alaska has already been messaging on this. The other problem here, of course, is computer keyboards, which are very difficult to clean due to the spaces between keys and so forth. Some people have been covering them with saran wrap, I think. Don't know if that works or not. We'll look quickly here at indoor air and indoor air pollution. There are things that parents and school personnel should be aware of. And when you can suspect it is when the roof is leaked or the building smells damp or has been flooded, the floors are newly surface painted or renovated, the building's fully carpeted, your child frequently comes home from school with odd smells on his or her clothing, your child has health and learning problems only in that building and not during days off and or in other settings. So there are a number of classic symptoms here. This comes from an EPA list and what they're typically associated with. So the way to read this is rhinitis and nasal congestion, 1, 2, 3, 4, and 6. So that would be number 1, sick buildings, 2, combustion, 3, biologicals, 4, volatile organic compounds, but not 5, not heavy metals, and 6 would be tobacco. So it's a chart that you can follow and think about if you have these symptoms typically on a school day, and when you're in the building or your child's in the building, you might connect it to some of these other issues. So in terms of indoor air and ventilation and aerosol transmission, which has been kind of a long delayed topic here when it comes to COVID-19, ASHRAE has published extensively on it, and EPA, beginning in July, started a series of very, very good US EPA webinars from the Indoor Environments Division on how to control the airborne virus, how to take a look at your mechanical ventilation systems. And I think one of the important things here down on the bottom, and a good example is this 100-year-old school building in New Jersey on the right, is that schools may lack indoor air quality controls. And that comes from a new report in June from the US Government Accountability Office, that HVAC systems in 36,000 school buildings should be updated or replaced. Those were only the buildings that had them. There are a lot of buildings that don't have mechanical ventilation systems. So again, we get back to the problem of the absence of public health in schools, where no agency at any level in any state is routinely monitoring environmental health hazards in schools. It is an issue. If you are in a school that does not have mechanical ventilation, there are, and I'm not sure what to recommend in Alaska because of the weather differences between where I am and where you are, but in the Northeast, they're talking about box fans and individual fans to ventilate schools. So some of the examples that you can do is ensure that if you have tall windows that they can open top and bottom and are screened. You can install vents to the outside, which are really critical in the nursing office, lavatories, kitchen, or gym, or use individual classroom air cleaners. They're very effective and they will work. Just make sure they don't produce ozone. We're very grateful to our friends from the Asthma and Allergy Foundation of America, and this is a fabulous chart. Took them a long time and a lot of peer review to get it out the door. But this is how do you tell the difference between COVID, the flu, cold, or allergies? And I won't go through the entire list, but the first chart up here at the top, the first column is the symptom, the second column is the coronavirus. Length of symptoms, 7 to 25 days. A cold is usually less than 14 days. The flu is 7 to 14. Seasonal allergies, off and on for weeks for those of you, all of us who know what those are. So there are differences here. And one of the things we're seeing happen, which I think everybody could predict, is we're so worried about contracting possibly COVID-19 that we don't want individuals, whether they're staff or students, unnecessarily excluded from school to quarantine. So it's really important to have some medical backup and a school nurse who can take a look at this. I'm going to close with offering sort of a backup plan. If your state is not helping your schools with very specific detailed information, what parents and communities can do, and school personnel as well for that matter, is actually ask schools to produce specific information. It's not enough to pick up the phone and say, by the way, what did you do about indoor air? Well, I did X. That's not really a reliable accountability plan. In terms of indoor air, you want to ask, do you have a written plan for enhancing the ventilation at school? Does it include assessing the system, upgrading air filters, flushing the air out of the system before occupancy? If you do not have mechanical ventilating, do you have air cleaners in the classrooms? Similarly with drinking water, did you talk to public health before you opened the closed water systems? Cleaning and disinfecting, do you have a written plan for cleaning and disinfecting? That might look a little bit like the memo from New York State Department of Health and Education that lists all the things that need to be done, but what's the frequency? Are you going to do that every single day or twice a week, or everybody takes Wednesday off and cleans the school in the middle of the week? And it goes on through many of these actual individual items. Taken together, these highly specific actions, in fact, if they're in writing, becomes an infection prevention and control plan. But it's something you can do locally. So some of the resources we used here clearly come from US EPA, its Healthy Schools, Healthy Children website, which leads you to a lot of great information on good topics about indoor environments in schools. Schools for Health comes from the Harvard T.H. Chan School of Public Health in 2017. It is a fantastic, easy to read recap of the hard science and the implications for indoor environments in schools. And I'll go on, but I think there's a lot of great information here. The bottom one is brand new. We're really pleased about it. The American Public Health Association just adopted a policy on Sunday evening, a couple of days ago, on COVID in the education sector, early lessons from the pandemic, about what's missing and what still needs to get done. And here we are back at the end again with questions. Please send us information or get in touch with us at info@healthyschools. And we'd love to talk to you. And Margaret or Nick, do you have some questions lined up?
Yeah, thank you. Thank you very much, Claire, for that presentation and for providing these resources, both the handout that you shared and these slides. It's information rich. And,
so do your folks have access to the handout? I don't see it on my side, but which doesn't.
So folks, if I sent out a link to the handout in the reminder email, and it's also on our ACAT website at akaction.org. If you go to the Alaska page, we have it in the description of this this webinar. And I think I'll pop it into the chat as well, so that it's all over the place. But yeah, that seems like a good summary.
Right.
With with our remaining time, we've had some questions come in, but yeah, if anyone else would like to invite you to type in your questions or comments into the chat box, and we'll get to those. And it looks like Claire's provided her contact information as well. So we've only got another 15 minutes, so we'll see. We'll see how far we get. But so for starting off, you did describe a bit about indoor ventilation and indoor air quality. But another question on that topic: are there good indicators for measuring indoor air quality? And the questioner asks, like what is it, particulate matter 10 or smaller, so those kind of inhalable sized particles. Are they a good?
Nobody, even EPA doesn't recommend testing indoor air. It's a really complex stew. What they do recommend is you follow the guidance in their indoor air quality tools for schools kit to save a lot of money. Testing indoor air is very, very expensive, and it tends to show, because there aren't very few standards for it, it tends to always come up with a little piece of paper that says your school air is safe to breathe. It's because it's an OSHA standard. It's meant for 50-year-old white males in an industrial setting, and it doesn't really pertain to women and children. So before you go down the route of doing indoor air quality testing, it would be wise to do as much as you can on your own, following EPA's guidance through its Indoor Air Quality Tools for Schools program. You really don't want to get involved in testing until you get to the end of the line. You say, we've done everything we can. We still have air complaints. We've pulled out the old carpeting. We've remediated mold. We've patched the roof. We've fixed the ventilation system. We think it's all working. We've tested it with, wisps of paper are moving when the ventilation system is on. We've done the really logical things that anybody can do on their own, and we still have problems. That's when you're smart enough and you've learned enough already so that you can provide an incoming consultant with some background and some information about what's still going on and what kind of health complaints they're having.
Yeah, that makes sense. In terms of those protocols, there were a few other questions that were kind of more specifically about indoor air quality, like a lot of teachers have pets, or would a HEPA filter help in a classroom that doesn't actually have any windows?
Yes, individual air cleaners, absolutely recommended. If the windows do not open, you don't have a mechanical ventilation system, you have to have air. HEPA filters would be great. I think the individual room air cleaners, make sure they're properly sized for the size of the room. Maybe you need 2 instead of one massive one. It still requires maintenance. So it will tell you on the user's manual how often to check the filter, what to look for. The same is true. I see there's a question that popped up about how often to maintain filters. You have to look at them very carefully. ASHRAE has good advice, EPA does. I think with a virus, you probably want to change them more often. If they're dirty, you have to change them. You must.
Yeah, that makes sense. We also have questions about, you describe, that many teachers or students are being asked to help clean and disinfect the school environment, and that there's some concerns around this. But yeah, so who should be doing the cleaning or the sanitizing?
Paid staff. Paid staff should be doing the cleaning and the sanitizing. Absolutely. Children should not use school materials that schools have purchased for the purpose of cleaning and disinfecting. As I said, disinfectants are antimicrobial pesticides. Every single one that we have seen, like the Lysol or Clorox wipes that are effective against the coronavirus, they're all labeled not for use by children. So do not give them to children. They're labeled, follow the directions, do not give them to children. School-based cleaning materials are also in the same category. The schools are very large kind of commercial scale buildings, and they use different kinds of cleaning products, typically not what you buy in the supermarket or the store down the street. So, you can certainly, kids can help keep their room clean, keep it neat. A teacher might want to have a little bit of a cleaner or a disinfecting wipe by her desk. You might have a wet wipe if you're doing breakfast in the classroom and you want to wipe down a desktop with a damp paper towel or a wet wipe. That's something else. Just make sure that what you're wiping with is unscented. Anytime you're using high volume of cleaning and disinfecting products in an enclosed area, which is what's happening with COVID, if more schools are using more cleaning products and more disinfectants, the least you can do is make sure they're unscented and you're not introducing more pollutants into the indoor air.
Yeah, thanks for that, Claire. Another question, excuse me, was it says outdoor classrooms are being utilized in many parts of the country to reduce transmission rates in schools. And they ask, how would you bring this option to a school district with equity and inclusion in mind?
Well, I think it depends where the location is. If this is a low income school in a rural area, that's not a big problem. The problem is who's going to pitch the tent and do you have to rent it? In an urban area, that does become a problem. In a crowded, impacted urban area, that is a problem. And that's one of the things that's happening, where you see resourceful schools in high-income communities can go out and hire the best consultants and bring in the best materials and the best air cleaners and the best devices and the best tents. Other people can't do it. So this is something that COVID is certainly doing in terms of the educational system, is laying bare all these disparities we have known for a long time, that the poor schools are in the worst condition. They're not prepared for indoor air. They're not prepared for the pandemic. They have sanitation problems. They're not prepared for the pandemic. So it's a very difficult issue. It's a great question. Thank you.
Yeah. We had a question about exposure, increased exposure to wireless.
Right.
Yeah, so like one of the outcomes of back to school and distance learning during the COVID-19 pandemic has been the large increase in wireless exposures for school children, wireless devices, laptops, etc. Yeah, they refer to is non-ionizing radiation from wireless devices and infrastructure a concern?
So what's happening, I haven't seen any new peer-reviewed literature on that, but I would make the same assumption that if everybody is now on a device and learning from home, they're going to be, and spending more hours screen time, they're going to be more exposures. That's true. I talked to my board member, David Carpenter, who has been a pioneer in this field of EMFs and exposures, and asked him if he knew of any simple change that would work on that. And he said no. I mean, so the question would be, for our particular purposes, looking at schools and school responsibility, if they are handing out devices and asking children to use specific devices, are there devices which are low EMF devices? And I believe there are not at this particular period of time. So if children are working from home and learning from home and have a device, their exposure would be whatever the exposure is in their own home, if it's wireless or not, or maybe they're hardwired in. I don't know.
Yeah.
I don't know if that answers the question, but that's what we've got at the moment.
Yeah, no, I appreciate it. There's a question here about, who pays for individual air cleaners? Is it the school district, the state? And I think you can even extend that these paid staff for cleaning. Is it funding, broadly speaking? Where does the money?
Well, if it's a device that the school wants to install, the school is going to have to cover it. There are cases where local booster clubs or PTAs may have chipped in to help out with something like that. But it's a medium expense if you're going to include 1 or 2 air cleaners in every classroom and keep them maintained. Just the way putting new fans in and doing other installations. On the funding topic, this is exactly another disparities issue where wealthier districts can afford to do it, wouldn't ask anybody else to contribute. And again, the poor schools are going to have the worst problems. There are a couple of bills pending, federal bills. Both were passed the House. They have been blocked in the current U.S. Senate. There were some early bailout bills for schools, but the bailout on the facility side has not gone very far. The biggest one is a bill that we've supported for a couple of years now, called RASA, the Rebuild America Schools Act. And that would, if ever enacted in appropriations, would provide $100 billion over 10 years to rebuild America's public school infrastructure. So a stripped down version came out of the House this summer that said, well, we're not going to get the whole thing. Let's take 1 year. Let's take 10 billion and see if we can send 10 billion on an emergency basis for schools to work on ventilation and water systems. Passed the House, stalled in the US Senate. So that hasn't gone very far. We supported that well. The other thing that we have supported, again, has not traveled very far, although we've had strong support in the Senate, thanks to New York Senator Kirsten Gillibrand and about 22 other senators. We've had warm conversations with Senator Murkowski. And that is refunding and restoring and refunding EPA's voluntary programs that address school environments. So it's indoor air quality and water quality and molds, and it's the array of indoor environmental issues that all schools across the country have to deal with. There used to be a series of very good, very well-respected, proven programs that EPA ran for a number of years. Those programs gradually ground to a halt with repeated federal budget cuts because they're voluntary programs. EPA is a regulatory agency. It's required to maintain certain regulatory programs. So the way it survives during budget hits is to gradually drain out funding from its voluntary programs. On the other hand, those voluntary programs did a heck of a lot of good things, and we'd love to see them restored. Our ask is to put $1 per child enrolled in schools and childcare back into the EPA Indoor Environments Division and Office of Kids Health. That's a total of about $65 million over the previous EPA budget year. And it's less than a rounding error at EPA, and it's invisible at the federal level. It's such a nanoparticle of budget. But we haven't been successful. I don't know where the opposition's coming from, but we've got it. I saw there was a comment. Yes, I'd be happy to share our action alerts with ACAT. I'll send them off to Pam and she can share them with people as interested. Be happy to do that.
Yeah, that'd be great. There was also a question that we're nearing the top of the hour, but wondering if the list of green cleaning tips or other resources is available in Spanish.
No, I'm afraid not. We have not done a translation of that. I don't know how effective. They're all Word docs that were converted. I think you can probably try a Google translation on them. I won't guarantee how effective that is, but at this point it might work pretty well because Google's been doing it for so long. Mm-hmm. No, we have not done that.
Well, we are nearing the top of the hour here. Let's see if there's one more.
I want to say one thing about the disinfecting sprayers and misters and foggers. We did a special expert panel discussion that we hosted at the end of August because we saw so many people, school business officials, school superintendents all across the country buying into these gizmos, and they don't necessarily work. What we're doing here in New York as a New York-based nonprofit is we've just done an op-ed in the state capitol newsletter. Happy to share that with you. Calling for the state to require certification of the applicators. It's really important in schools. All too often, although custodial workers ought to be well paid and well respected, they're not necessarily well trained. They may not necessarily have a great reading and writing skills. So we want required training and certification of people who do the applications, because disinfection depends on, you have to clean the surface first. You have to have the wet product sit on it for a specific period of time, the dwell time, and then you can leave it. And if you don't have the right amount of product, you don't leave it, it evaporates, it's not going to work. And it's a very expensive device. And meanwhile, what you're doing is you're spraying disinfectants throughout the building and they're in the air. What we've heard from the pediatric environmental health folks in New York is they're now coming up with specific cases of children with new asthma in school because schools have been fogging with quaternary ammonia compounds. So this is not helpful. So we're going after, since all these devices are already in place, we're looking for a certification for pesticide applicators. If they're going to do it, they need to be pesticide applicators.
Yeah. Well, thank you so much, Claire, for that presentation and for answering those questions. We're already getting, many people in the chat are really appreciating it. And I really enjoyed the call too.
Well, thank you. And thanks so much for the invitation. We really appreciate it. And I'm glad all the timing worked out, and we're still doing this in Children's Health Month, and we're still doing this in Lead Prevention Week. So I think this is great. So again, thank you so much. And I look forward to connecting with all of you all over again on all these great issues.
Yeah. And thanks to our participants, the listeners today too, everyone who joined us. And I'll send out an email in the next day or two with a link to a recording of this presentation and the conversation, and as well as a list of related resources too. The next Shea Alaska call will be on Thursday, November 19th. And we'll be joined then by Dr. Gail Christopher for a conversation about equity and social determinants of health and the role of racial healing in solutions to problems related to environmental health and justice.
One of the social determinants of health is education.
You're here. That's high on the list. So finally, I'll close by, I hope you'll consider making a donation to Alaska Community Action on Toxics to support these monthly calls. And your contribution, of course, helps provide the support we need to continue bringing you these each and every month. And you can give on our website at akaction.org. And if you have any additional questions or comments, please feel free to contact us. You can reach us at 907-222-7714. And yeah, thanks again to everyone, and I hope you have a wonderful rest of your day.